The Human Sciences Research Council has released key findings from the 6th South African National HIV Prevalence, Incidence and Behaviour Survey for Limpopo Province. The survey, conducted between 2022 and 2023, highlights a decline in HIV prevalence but reveals ongoing challenges in treatment and prevention. Joining us to discuss this further is Dr Sean Jooste, Chief Research Specialist in the Public Health Societies and Belonging Research Division of the HSRC. Dr Jooste is one of the principal investigators of this study. Good evening, Doctor. Thank you very much for joining us on The Full View. The key findings of this report are quite interesting. A decline in HIV prevalence, but females are still most infected. Take us through the findings.
Good evening, and good evening to your viewers. Yes, so there was a stabilization in HIV in the Limpopo province, but we still see that females are, the burden for HIV is still higher among the females. We also found that it looks like in the province between the last survey we conducted in 2017 and 2022, that the peak has also shifted now. Before the peak was with age group 40 to 44. Now it's moved to the 50 to 54-year-old. And the good news was that the peak has also decreased from 30%. The peak is now sitting at 29%. So you can see that HIV is it's an aging epidemic now in Limpopo.
What can we attribute the decrease in the HIV prevalence in the province to?
So what we've noticed now is that with regards to treatment, to the number of people that's covered now, that's on treatment, our ART coverage. In 2017, the ART coverage in Limpopo was sitting at 62%. That has increased now to 80%. So
pardon me, so when we're talking about ART, we're talking about antiretroviral treatment, yes.
Yes. So it's a number of people that are positive that actually are on treatment. So that's a good step. And the goal is, once you're on treatment, you want the virus in the person to be so low that it cannot be detected. So we say it's virus suppressed. And if it's not detected, the person cannot pass HIV to anyone. So with regards to treatment has improved. With regards to viral load suppression, now the detection that the virus is not more present in the body, or you can't detect it. In 2017, it was sitting at 60% viral load suppression in the population. That has increased now to 77%. So treatment has improved, treatment coverage has improved in the province, and also viral load suppression among positive people have also improved.
I'd like us to look at the demographic disparities as well, because it seems as though the rural areas have a higher prevalence of HIV.
That's true, and also what we also find with regards to treatment. So we also find that among males, the ART coverage is much lower than females. So we have a situation where positive individuals in the province that's know they're positive and they go into treatment, that's a problem among males. So we have this issue that we need to focus on males, especially adult males. They are positive, but they're not going onto treatment. With regards to suppression, it wasn't quite different between males and females. That was quite similar. But a big concern is that we're not getting our males onto treatment.
So when we look at the rural areas and why exactly it's more prevalent there, what have you found to have been the reasons? Is there difficulty in perhaps accessing the ART, or what exactly is happening?
No, it's a very big province. And when we had the dialogue today and spoke to people from the province, that's one of the issues that they raise, is that some areas are very rural. I mean, the province is majority rural, and sometimes it's difficult to access, even with regards to prevention, for example, like PrEP, to prevent somebody from becoming infected if the person's at high risk. PrEP is available, but they said it's so far for in some of these areas. Even when
but are they familiar with it? Pardon me, but are they familiar with the pre-exposure prophylaxis? Do many of them, when you engage with them, do you get a sense that they know that it exists there to protect themselves if they are to be involved in some sort of a sexual encounter with somebody who's positive?
That is a problem. So in Limpopo, only 20% of people that we interviewed ever heard about PrEP. And when you looked at the number of people that ever took it before, you're looking at 2% of the participants in our survey actually took PrEP before. but there was a high proportion of people that indicated that they are willing to take it. They never heard about it, but those who never heard about it, you say what it is, there is a high indication that they would actually take PrEP.
And then the post-exposure prophylaxis, do some of them know about that one for rape victims?
That's also very low. So those two, but the one that we focus on primarily in our survey was the PrEP, the prophylaxis.
But broadly speaking, it seems that the results, though, are quite positive in Limpopo, even though you still say that, as per the data, it seems that there is some sort of a problem when it comes to the treatment and prevention.
Yeah, so it's positive in that, there are still gaps, but it is positive that it's stabilized now. What's worrying is some of the key drivers when we looked at, for example, condom use. Condom use has decreased in the province. Multiple partnerships are still high among youth. So some of those key drivers still needs to, there still needs to be attention in the province. So what the province is doing, they should continue, try to get people to know their status. Once they know their status, get them on treatment, but also continue with this awareness. Speaking to people in the province, they indicate that there's very little awareness now, around condom use, reducing multiple partnerships. So they feel there should be a concerted effort, to bring the message to the people.
Doctor, this data is quite helpful. I'm sure even government will be able to assist it on what they need to do next in their efforts to reduce the HIV prevalence. Thank you very much for joining us this evening. That's Dr. Sean Jooste, Chief Research Specialist in the Public Health, Societies and Belonging Research Division of the HSRC.